Last winter, over 6,000 people presented to the emergency department with nasal congestion, which might sound ridiculous to us, but if people don't know better, then what do you expect them to do? Nasal congestion can feel awful. You've got a blocked or stuffy nose and you're struggling to breathe. Now, often it forms part of a viral infection. Sometimes it's because of sinusitis, sometimes it's just part of an upper respiratory infection which is affecting your ears, nose, and throat, and like the main windpipe that goes down into your lungs. If you've got a blocked or stuffy nose, often you just kind of need to wait it out. Sometimes you can get facial pain. Sometimes you can get pain like across your forehead and on your cheeks, particularly if you lean forward, and that may suggest that you have an infection within your sinuses. However, the overwhelming majority of sinusitis are caused by viruses, which means that antibiotics and things like that aren't going to do anything. And your body will naturally just recover within a couple of weeks. Now, usually for the first kind of 3, 4, 5 days of one of these illnesses, you might have fevers, you might have shiver shakes and chills, muscle aches, body aches, just feeling absolutely garbage. And usually it's caused by a virus. Antibiotics, as I say, do not do anything for viruses. Your body has various mechanisms in place which helps it fight off infections. The best thing that you can do in these situations is stay hydrated, make sure you're resting. If you feel like your nose is really blocked and congested, you can use saline nasal drops. You can do saline nasal rinses. I generally don't recommend using nasal decongestant sprays because they can be very addictive, but using some nasal steroid sprays can be very good. But again, that's only usually recommended if this has gone on for longer than a couple of weeks. And look, the majority of patients that present with nasal congestion have usually had it for at least a week. And they say it's not getting better. But when we look objectively at the course of their illness, they usually will have had some fevers on days 1 and 2. And now they're no longer having fevers. They were having muscle aches and they weren't really able to do much on the first couple of days. But now they're able to do a bit more. So objectively, things are improving, even if it feels like the nasal congestion is just still there and really bad. And that is reassuring.